All right, welcome back everybody to the brain injury discussion. This is your host, Jay. Today we are going to talk about brain injury by choking or strangulation. Again, sources will be in the description below. I know we've talked about anoxia and hypoxia, but today we're going to be looking at the actual mechanism of injury instead of just the resulting diagnosis. And we'll see that this has a lot of practical applications here, not just for people who are in this professional brain injury, but also for clinical documentation as well as lay people as well, what we can do about this. So stay tuned, but we'd appreciate your feedback. Feel free to subscribe to the channel. We try to put out this information weekly and we try to keep it informative, educational, but also applicable. Um, but with that being said, we have a lot to get into. So let's start by talking about strangulation. Strangulation, per the definition of the source, which is down here below, it'll be in the description, is applied force to the neck. So we're talking about strangulation here, which is, as we can see in this case here, we can see that there's some scarring right there showing applied force to the neck. Again, strangulation, that's not a good thing usually. And I would generally say, let's try to avoid strangulation if possible, but let's be able to identify it. That might indicate a situation kind of like domestic violence, or it might indicate some other kind of violent action being done against the person who might have a brain injury because of this. And what we see with strangulation is this, which is compression of the carotid artery and the jugular veins. The carotid arteries are right about here, and they run up and provide the brain with blood flow, and they are quite close to the windpipe or the trachea. And also, we see the jugular veins, which are over here, slightly more to the lateral side, and that's where the jugular veins are. So JV for jugular veins, CA for carotid artery. So this is about anatomy. This is another good anatomy discussion here about what provides blood flow to and from the brain. And so strangulation is the applied force on the neck, which is the compression of the blood flow to the neck, which again, that's a very serious thing. This is a very serious conversation we're having. Um, but we see that what happens during strangulation event is that it impairs cerebral perfusion. Again, that's a fancy word about oxygenation, so O2. And so if the blood that is carrying the oxygenated blood to the brain, let's say can't get there because of applied pressure to the blood vessels there, it will lead to cerebral um, damage due to the lack of oxygen, which, perfusion is the oxygenation of the cells. And what that really does is it leads to a hypoxia, which can lead to ischemia, hypoxia, not enough oxygen, and ischemia, which is the death of cells. And again, those are deaths of brain cells. And so when we do an Ohio State screening on someone, one of the questions is, have you ever been strangled? And has this ever happened? Again, it's one of the ways that we can identify or screen for a potential brain injury due to an event such as strangulation, which again, in most cases, it's vascular. We're going to get into choking. This is something that, again, if you're a clinician or you're interfacing with clinicians, this might be a good documentation point, a good differentiating point from choking, which is a different kind of mechanism of injury. And so we're seeing that, okay, compression to the carotid artery and the jugular veins. Again, when a clinician documents that, that might be able to help with, further documentation down the line. And it also can lead to a brain injury. So keep that in mind when you're interfacing with people or when you are interacting with people. And maybe if you notice that something is off, again, you might see a mark on their neck. It doesn't mean that it doesn't always mean that, but that might be something as a brain injury case manager I want to be aware of. I want to make sure my clients are safe. And if I see something like this neck here, that would raise some red flags with me and that would cause me to act. Again, mandated reporter here. So keep that in mind. This is something that you might want to be aware of. But let's move on to choking. Again, this is just as bad, just something that causes a brain injury as well. But what we see is that the mechanism of action is different, and choking is the obstruction of the airway. So the usually people think it's the throat. It also includes the mouth, the nose, anything that obstructs the airway, and it's usually because of a foreign body airway obstruction. Again, obstructing the airway, preventing the air to get in to provide the oxygenation needed for the blood to go up to the cells of the brain that can cause a brain injury. And where do we usually see choking? Well, we see choking is quite common with pediatrics, so children under the age of, shall we say, younger children, you might say. But we also see this in elderly patients as well, and elderly clients and elderly members of an organization. So these are things we need to keep in mind about a patient population. And so when we're looking at this, what about the children? What about pediatrics? Well, think about toys and objects, especially if they don't know that much better, or that maybe they're not at the point where they know that this is a toy, not an item of food. Maybe they're sticking it in their mouth on purpose, maybe not. Um, but keep that in mind, especially if you have children or work with children. And choking is an easy way to get a brain injury, unfortunately, and especially with children. But we also see this with the elderly, with food, specifically food. And we can see that the airway can be blocked by food or objects alike. It does not have to be one or the other. It can be both. It could be who knows, but it's really just the obstruction. It's the blockage there. And the asphyxia, which is, preventing the choking aspect of it, leads to hypoxia, which leads to cerebral ischemia or the death of brain cells. And so we don't want to have that if possible. And so, what are some of the implications of this? Well, what to look for in someone who is, in fact, choking. This is something that I would encourage people to take a CPR class. They teach this. But what we see from someone who is actively choking is there will be no sound. So air can't get past or move through the vocal cords. There won't be sound when someone is choking. You might also see this thing called cyanosis, which is, obviously with the lack of blood flow, some of their body might turn blue or purple, especially think about the lips. That's a very common one. And it is a result of hypoxia, which is a brain injury. We might also see an ineffective cough or gagging. Maybe it's not totally occluded, but maybe it is occlusion, or maybe the occlusion is much to where they can get a little bit of air out, but not enough air to really sustain life. And also the inability to vocalize. They will be trying to vocalize. They'll be trying to talk, but due to the airway obstruction, no air is able to really flow past those vocal cords, and so, what we see in someone who is choking, again, this choking can happen from here to here, all the way down. Again, there's a number of different ways that people can choke, but what we'll see is that the vocal cords won't have any air moving by it. So that's something to keep in mind, and it should draw us to this next slide. How do we address an airway obstruction for choking? So the thing I would like people to take away from this video is there is this thing called the universal choking sign. You see it in this graphic on the right here. It is both hands, not grasping, not choking, but kind of around the neck. That's a universal sign for, hey, I'm choking, I need help. Um, Obviously, you want to react calmly, but you also want to be quick about it. The longer that they stay in a choking state, the more brain cells that will end up dying because of the hypoxia and the cerebral ischemia. And so this is where people will teach the Heimlich and CPR, possibly if indicated. And so that's why I encourage people to take that class. Hey, learn how to do the Heimlich, learn how to do basic CPR. Um, Also, we should prevent children from being around unsafe items if possible. Again, that might be a big ask in some areas, but we try to make the situation as safe as possible so that way this kind of this kind of situation does not occur, or at least a whole lot less likely to occur. Also, we want to remove bones from the food for the elderly. Again, they might not see that bone, they might not taste that bone, they might not be able to chew it as much, they might not be able to identify that bone, so it might get stuck. And obviously, that's something that somewhere, for example, a nursing home, they could address that problem by taking the meat off the bones or taking the bones out. And there might be small bones in there that keep something from going down. And again, this is all preventative here. So, as a brain injury case manager, what does this lead me to conclude? Well, I need to be aware of choking hazards. Again, not just for children, but also for the elderly as well. Think about the elderly clients that we might work with, people who maybe they don't have the strong swallowing muscles that or strong neck muscles to swallow bigger items of food. Maybe they need softer food. All that could be something that a case manager might be able to address. Same thing goes with we need to be aware of strangulation injury. Again, if there's a red flag there, that is strangulation is one of those red flags that should call a case manager as soon as they notice it to action. Especially given how this could lead to something a more serious situation. It's one of those signs, but it's also one of those things that can cause a brain injury as well, due to the lack of blood flow to the brain. We also need to know the anatomy, kind of tying in with strangulation. We need to know the anatomy of blood flow. We need to understand how this happens because that kind of ties in with choking as well. We need to understand how the blood gets oxygenated, how it carries those vital nutrients to the brain. Also, as a brain injury case manager, I need to look for possible risks and reduce them if I can. I'm not going to be able to reduce every single risk. But if I can identify one thing that I can fix, I think I've done my job. But look for the risk and try to reduce it. Again, especially with the elderly, with food, especially with children and objects and toys that, might be small enough to be put in their mouth. But the big point I want people to take away is I want people to prepare and to educate themselves so they can certify and learn basic life saving, CPR, and the Heimlich maneuver. So that way you know how to address someone who is choking. You know how to address someone um, who might be in that event at the moment. Again, this could be a difference between life or death. This could be a difference between brain injury or maybe small brain injury. This could be the difference between addressing it immediately or having someone um, have to take time to come and address that problem. I think everyone should at least try to get certified with CPR, BLS, Heimlich, wherever it is in your state. I think that's a very good thing. Your local health department probably offers it for free. And so I would encourage everyone to at least consider getting BLS and CPR certified because that might save someone's life. But like always, here are my resources. I hope everyone has a wonderful day, and we'd appreciate your feedback in the form of either a like, maybe a comment, or maybe subscribe to the channel. We try to put out this information weekly, and we try to keep it informative, educational, but also applicable to daily life. And I think being certified in basic life saving or CPR or Heimlich is a very practical thing. And being certified will help you not only understand what to do in the reaction of it, but it also that certification will protect you. Certain states have Good Samaritan laws, but not every state does. And so having that certification and acting is just a general good practice. I think that's a good thing, and it also might protect you legally. But that being said, I hope everyone has a wonderful day, and don't forget, protect those brains.